Turns out sexual difficulties, which unfortunately much more of the data is about male erectile dysfunction than female sexual health, but we got to believe it's all one physiology system and connection. But a loss of interest in sex, a loss of ability to have a sexual response is actually a very reliable clue that you have bad cardiovascular disease, and you can't ignore it because all those other clues are called heart attacks and stents and bypass and death.
This is Doctor Talks.
Hey everybody, welcome to another episode of our Sexual Health Summit. I am so excited about our next speaker. Our interviewer here is Dr. Joel Kahn, an amazing cardiologist who's going to make so many connections for us around the cardiovascular system and sexual health. He has recently put on the Reversing Heart Disease Summit. That's going to be relaunched soon, so we'll learn more about that. Let's get started. Thank you so much for showing up for this interview today. I'm really thrilled.
I'm excited. It's actually an incredibly good and important topic to bring sexual health and cardiovascular health because they are largely one topic.
Yeah, they really are. And let's start with that. You really launched into I think, great way of starting. So tell us why they're one topic. How are they related? Let's start there.
Yeah, so I am a cardiologist practicing in Detroit. And, the medical model that I've been using for nearly 35 years is you find out about heart disease when you start to get burning pressure tightness mowing the lawn, or you find out about heart disease when you call 911 because you're sweating, can't breathe, and your chest is tight at 2 a.m. Or maybe you have a stress test, or maybe you drop dead. 1,000 people a day in the United States. I don't know how many around the world. The first clue to heart disease, it's a horrible problem. It's called sudden cardiac death, is actually you're found dead on the bathroom floor. You're found dead on the toilet, like Elvis. You're found dead in bed. Maybe your car's at Walmart and they knock on the door and you're dead. I mean, this is a horrible system we have to identify the number one killer of men and women. It turns out sexual difficulties, which unfortunately much more of the data is about male erectile dysfunction than female sexual health, but we got to believe it's all one physiology system and connection. But a loss of interest in sex, a loss of ability to have a sexual response is actually a very reliable clue that you have bad cardiovascular disease, and you can't ignore it because all those other clues are called heart attacks and stents and bypass and death. So, for example, the most remarkable study, and it hasn't been reproduced everywhere, but around the Mayo Clinic, if I remember the county that the Mayo Clinic in Rochester in is called Olmsted County. A publication maybe 10, 12 years ago said that a man in Olmsted County who's reporting erectile dysfunction to his primary care doc had more than 40 times, 40, a smoker 2 to 3 times, a man with erectile dysfunction, 40 times the risk of developing clinical heart disease, angina, heart attack, stent, bypass, death. Pay attention, doctors and nurses and spouses and partners and friends. It isn't just the bedroom or wherever it's taking. It isn't just the frustration. It isn't just the ego hit that it takes to start having sexual impairment problems. It's the clue. It's the clue. So for anybody that hasn't heard this, there was a habit 100 years ago. Miners would take a canary in a cage into the coal mine because if the carbon monoxide silent killer was in excess, the bird would stop chirping and fall off its perch, and it would be a sign to the miners to get the heck out of the mine and get some fresh air. And we say the same thing, that erectile dysfunction or sexual impairment may be a canary in the coal mine, may give you a clue. So you get to your doctor and you check your blood pressure, you check your blood sugar, you know your cholesterol, you get a stress test, you get a heart CT scan. We can talk about any of these. And maybe it turns out it saves your life. Now, not every case of sexual impairment is cardiovascular, but it's a big piece of the pie. And it has to be addressed rather than just pull out that script and write that generic Cialis or maybe a hormone replacement or some other approach for a female having issues. Get your heart checked. So the last thing I'll say is there is an abbreviation used widely, ED, erectile dysfunction. But we say the other abbreviation for ED is endothelial dysfunction. The lining of your arteries are sick. And the final ED is the emergency department, where you go when you have a heart attack or you're dead. There's a lot of overlap between those three EDs: erectile dysfunction, endothelial sick arteries, and the emergency department. But we have the ability, just by these conversations, bringing it up, making it public, and everything I'm talking about has been well known for a good 25 years. There's a symposium and a seminar called the Princeton Seminar, where they bring urologists, endocrinologists, cardiologists, vascular specialists, hormone experts, and they've been publishing data that primary care docs hearing about sexual dysfunction should think cardiovascular, should test for cardiovascular, or referred out to get tested for cardiovascular. But it doesn't happen. It's just too easy to get the script pad out and not address the potential root cause, which I'm sure you practice, I practice. It's the medicine of why. Why are you having this problem? Is it testosterone? Is it, complete hormone imbalance, thyroid imbalance, stress, sleep, psychological relation issues? Or is it just simply the number one killer of men and women: bad plumbing, bad plumbing, bad plumbing?
Yeah, I appreciate all. There's so much there for people. And I think the realization that this is an early canary in the coal mine, as you called it, early measure, right, of cardiovascular problems is really important, especially in men. And my next question for you is thinking about females. And we do know that females still have circulatory need to the female erectile tissue. So would you say then for females, since it's not as easy to classify something like with men, it's like ED is a lot easier to be like, for men to be like, oh yeah, there's a problem here. So for females to watch out for, say, an earlier sign of cardiovascular, would you say that, say, a lack of arousal, a lack of lubrication would be reasons to consider a cardiovascular problem?
Yeah, absolutely. As everybody knows, there has been now for, 25 years, these drugs like Viagra, sildenafil, and Levitra, and now the market leader is generic Cialis called tadalafil. And they work through that endothelium lining of arteries and that miracle molecule, nitric oxide, which won the Nobel Prize in Medicine 26 years ago. Women have the same, biochemistry and anatomy and physiology of their arteries and their lining. So it's absolutely known that, for example, there have been studies, and I'm not sure I'm up to date on every one, but there are women that respond to these same drugs because of improvements in blood flow, improvements in moisture, improvements in lubrication, improvements in artery health. I know there was some research in type 1 diabetic women that are going to be more prone to early artery disease, that they responded to a drug like Viagra with improved sexual interest and performance. So I think we've got a ways to go. I mean, the research is just easier. It's easier to measure a man's erectile ability. All the scales that I see published in urology data are usually about male erectile health, because it's just a measurable function that's a little simpler. But I think there's no question there's complete overlap. And the bottom line is women should be focused on their heart health just as much as men, and not necessarily waiting for sexual impairment as a clue. Get checked earlier than sexual impairment. Get checked when you're lusty and capable and horny as hell. It's still time to get checked, because heart disease has such a slow, silent deterioration time frame, years to even decades, and we just don't do it well. So all the ladies listening, if you're over 40, you should be asking the question: diet, sleep, fitness, stress, hormone levels, vitamin levels, regular cholesterol levels, regular blood sugar levels, regular blood pressure levels. Some advanced things like inflammation blood tests, and my favorite little genetic cholesterol called lipoprotein little a, which is going to bust out. If you want to buy a stock at a low price, look at lipoprotein A, because in 5 years from now, it's going to be a multi-billion-dollar pharmaceutical victory. And there are companies like Novartis and Amgen that have drugs coming down the road, but it's not a secret. It's out there, so I'm not giving insider information. But, there's a lot of things. And then I'm going down a path, but I'm a pretty, I want everybody to know their cardiovascular health in detail. There is this simple test called a heart calcium CT scan. You know, you're 45 years old, you're going to get recommended to have a mammogram or a thermogram and a gynecologic exam to screen for uterine or cervical cancer, and a prostate exam for prostate cancer, and a colonoscopy or a Cologuard. Nobody screens for heart disease in the United States. And it's an enormous flaw in our medical system when we know that more people die of heart disease, even in their 40s, 50s, 60s, than breast cancer, uterine cancer, ovarian cancer, all these things combined, prostate cancer. They're all horrible, but they are number 2 compared to heart disease. So you ask your primary care doc, I don't want to wait till I have erectile dysfunction or female sexual dysfunction. I want to be confident that in my mid-40s, I am weathering the storm of heart artery disease, just like you recommended. I make sure my colon's clean and my cervix is clean and my prostate is healthy. So you go get this heart calcium CT scan, which you can do in Golden, Colorado, and Boulder, and UCSF, and Miami, and New York. It doesn't matter where you are. And it's about a 5-second test where you're on a stretcher, you go in a circular CT scanner, no IV, no injection, not claustrophobic, no pain. 5 seconds, you hold your breath, you go home. Strangely, it's a self-pay test, except for Texas. Texas has a law that they will cover it when you're 50 years old, but I think you might want to even do it a little younger than that. And it might be $99, $75, $50, could be $125. So it's a pretty inexpensive, accurate advanced heart test. And you want to be 0. You want to have no evidence of what's called calcified plaque in your heart arteries. Hugely reassuring. And then do it again in about 5, 6, 7 years. Make sure you're staying at 0. But I tell you, if we would just institute that as a routine screening, men and women, men for sure by 45, women by 45 to 50, but I would never turn a woman away at age 45 that really wanted to get it done. And maybe even 40 if they had big issues, cholesterols that were super high, blood pressure super high, mom, dad that had heart attacks and bypass at a young age, get checked early. We would revolutionize, and we would save some people artery damage because you'd identify the problem early, just like you'd like to know you have a little polyp, not a big polyp in your colon, and you'd like to know you have hopefully a stage 1 breast cancer, not a stage 4 breast cancer. Find heart disease at an early stage, change your diet, change your fitness, get to a preventive doc that can work with all the aspects that are available, wonderful aspects, a lot of natural stuff. And you might save yourself sexual impairment, or you might actually get a return, treat your arteries and see your sexual interest and your sexual performance and your ability to enjoy this wonderful aspect of life come back, revive. There's a famous documentary called Forks Over Knives in 2011. And they talk about raising the flag on the flagpole, men who hadn't had really much of a sexual response for a while. Diet changes, lifestyle changes, stress changes, biochemical changes measured in your labs, like your cholesterol, inflammation. All of a sudden, healthy arteries, sexual response comes back, maybe with Cialis, maybe without Cialis. So it's going to happen in women too. I mean, real regenerative medicine, real renewal.
Yeah. So just so everybody is, making sure everybody's following this line of thought, it's like we have these situations of erectile dysfunction or arousal for, females too, sometimes as being the early signs. And then, where Dr. Kahn's taking us is some of these other early diagnostic, mechanisms where you can get these, an ultrasound, for example, of your carotid artery to see what the vascular age is, to see if you have a problem there. One of the things too, I think would be helpful for people to talk about is I typically, some of the research I've seen is that total cholesterol, our ratios, these types of standard blood work don't really do a perfect job of correlating to what's going on the artery level. So I think that would be another good thing to cover is like some of those basic, lipid panels that people are seeing. What are the pros and cons? How good of a job do they do with this early detection? Can you kind of continue the conversation a little bit there?
Sure. And there is a bit of an obstacle. I mean, you can go to your primary care doc and say, I learned about this heart calcium CT scan. I've got $99. I want one. They may actually say, I've never ordered one and I don't believe in it. And I discourage you and you're too young and your profile. So you sometimes have to be proactive, and it can be a bit of a roadblock because in most states for that CT scan diagnostic, you do need a prescription. A couple of states, I think like Indiana, you actually can arrange and get your own without a doctor's script. Same can be with the blood work you mentioned. Your primary care doc may not be comfortable or experienced in ordering. So I have no stock in this. You can go to a company called lifeextension.com, big vitamin company. You can order your own blood work. There's a new one out called lifeforce.com, LIFEFORCE.com. I have no stock in it, but you can get a pretty exhaustive advanced panel of blood work that you arrange on your own. And they charge, last I looked, about $4.99. If you had a doc cooperate with you, you might get more of it covered by insurance, but this is self-pay. And these are, for proactive people listening to this summit, the kind of things you want to do. So, a standard cholesterol panel is fine to do and nothing wrong. You want to ask for an inflammation test like the high sensitivity C-reactive protein. If it's elevated, you got to say, is my diet off? Is my dental health off? Is my sleep, like sleep apnea off? Do you got psoriasis? Do you got gut issues, colitis? Are you never exercising? Are you 50 pounds overweight? Are you eating processed food that dries up C-reactive protein? You want that. You want a test called homocysteine, HOMOCYSTEINE, which reflects this complex system called methylation, but an elevated homocysteine, I see it in my office, maybe 1 in every 10 patients, super high. You want to know that because it's easy to correct it with changes in diet and largely something called B complex vitamins that are geared for homocysteine. And then your blood vessels are better and your sexual health is improved. You want to know your 3-month blood sugar called hemoglobin A1C. You also want to know your fasting blood sugar, but this gives a little better perspective. Some people will get a fasting insulin level as even a little more specific measure of something called insulin resistance. Vitamin D, there's some primary care docs don't check vitamin D for overall cardiovascular and metabolic health. The biggest deficiency in my patient group, and I have a big vegan population because I am, but it's only still maybe 40% of the patients, is omega-3 fatty acids. The only fat in the body we actually need from our diet. There are others that may be healthy, extra virgin olive oil, but we don't need that. We need omega-3 fatty acid for our eyes, for our brain, for our heart health, for our joints. And there's a blood test for it. And I can't overemphasize how often people are deficient. And I will one day write a child's book about what omega-3 is and why it's important and why you should ask mom and dad for ground flaxseed and chia and hemp. Train them early, and then they'd have better bodies and better brains. It's amazing how frequent that's deficient. And then the last one I kind of mentioned, I believe, but there is a genetic cholesterol. Everybody has a liver that makes cholesterol, and you might have a liver that makes way too much, or you might be eating a diet that stimulates way too much, or you might have a liver that just makes an adequate amount of cholesterol for good health. But 25% of us inherit from our parents a liver that makes a second cholesterol, and it's called lipoprotein little a. It's a whole mouthful, LIPO protein, and then lowercase a. 25% of people, about 1.8 billion people in the world, nearly 2 billion. And you get it from birth, from mom, from dad, or both. And your body's revved up making 2 cholesterols your whole life. You have no clue. About 1 or 2% of doctors add this to their panel on patients, even in cardiology practices, 100% in my office, but 1 or 2%. And you find out when you're 45 or 50, damn, I'm developing cardiovascular disease. And somebody tells you, well, it's strongly based in part on a genetic inheritance. And then we can deal with it with integrative and nutritional approaches. But there are drugs that are being developed by some of these drug companies that will be helpful and will be welcome and will make a difference. There's no drug out right now for lipoprotein little a that's actually effective or approved. So Lipitor and Crestor are not the drugs for the 25% of people that inherited it. That would be a good beginning, 5 or 6 blood tests beyond the standard. But you don't see that in cardiology offices either. It's not like you're necessarily going to get better care. It's more advanced precision. We can call it integrative care.
Yeah. And it's people that are thinking beyond statins, like,
Right.
like you are here. So I want to clarify something I said earlier too. So you're talking about CT scan. And one of the things I was talking about was more, and I didn't say this correctly, it was more like a CIMT, like an ultrasound. So
Right.
Are you actually ever using that ultrasound, or you more recommend people ask their doctor for the CT?
Yeah.
Just
So
to be
just so
clear.
everybody understands, because your question is excellent. The CT scan is a wonderful thing. It's widely available. every small, medium, large city at the hospital. It's inexpensive. It's the same radiation exposure as a woman gets in a mammogram, which is usually considered, something to consider, but low. Plus, you only get this heart CT scan maybe every 5 to 7 years if you get it repeated. So and it costs $100 or less. But there are people that are hesitant about radiation, and there are a few limitations to this heart CT scan. You can't see something called soft non-calcified plaque. You can't actually measure how narrowed the arteries are. There are ways to do that, but you can't do it on this kind of widely available screen test. So yes, in my office, we are a major center doing carotid intimal medial thickness ultrasound, CIMT ultrasound. Problem with it compared to the CT, it's not widely available. It's rare that a hospital, even a university hospital with an interest in vascular disease, offers it. It's not covered by insurance, except for a few odd places like Texas. So you might pay $200, $250. The CT scan is a little less expensive. But you don't have radiation. You do see soft and hard plaque. You do know how narrow the arteries are. It's better than what people get at Lifeline screening, as an example. People pay $149 and they run a probe here and they run a probe on their abdomen. I welcome that data on people. It's not as accurate as I need for precision. But I mean, if the report says mild plaque in your carotids and you're a 44-year-old woman, that's disease, because when you're 54 and 64, that's going to be some serious issues, perhaps. So I pay attention to these subtle little clues. I mean, we're born with clean arteries. We can maintain clean arteries to the end of our days, but so many influences: air pollution, stress, sleep, diet, of course, fitness, of course, all these xenoestrogens, plastic bottles, microplastics, Wi-Fi. There's a zillion things that are stressing our vascular system out. The base, obviously smoking. I didn't mention, some of the ones that people are familiar with, but so, find out. And even if it's a church-based screening program, if it doesn't say completely normal, I'm a bit worried about you. The other thing, just to tell, some people have gone for the chest CT. They had a cough and their doctor ordered a chest CT, or maybe they had belly pain and they got an abdominal CT in the emergency room. A good radiologist should mention, although the CT was done for the lungs for the cough, or the abdomen for the appendix or something, a good radiologist will mention that the blood vessels are calcified, which is a sign of disease. And on a chest CT, they can actually comment that the heart arteries are calcified. It's basically a free heart calcium CT scan. So there is a movement to get radiologists to more routinely comment on the blood vessels and then alert a patient. I've actually had multiple cases where a dentist did an X-ray or maybe a CT of the jaw looking for a hidden abscess, and the carotid's all calcified, and they referred them to me. It's serendipity, but pay attention to those extra, predominantly CT studies, and ask the question, did they comment how my blood vessels look? I want to make sure I have young blood vessels.
Yeah, thank you for that. And for everybody listening, remember, if you're like frantically taking notes, which I know some of you guys are, if you miss this and you want to make the list of everything that Dr. Kahn's recommending for lab tests, remember, you can always go back and buy the Summit and slow it down and take that list, because I know there's a lot of things that, we've covered here. Where I want to move on next is, you mentioned this in the beginning around something that you and I share, which is the question of why. And so let's go there. Like, why are we why do people really manifest, besides, the apolipoprotein A, and we have a genetic component. So we know there's genetics, but beyond genetics, why the heck is this happening?
Yeah, I mean, the classic cardiology construct that goes back to something called the Framingham study, the American Heart Association, is there's 5 big things that cause your blood vessels to get diseased, and then you get sexual problems and other problems. You got diabetes, which has grown enormously, as everybody knows, because weight and obesity has grown enormously. And, McDonald's and Arby's and Taco Bell and processed food and grocery stores, and, 2-income families where nobody cooks and nobody likes vegetables and nobody eats fruit, and everybody thinks fruit makes you diabetic when, it's probably your donut and your Frappuccino making you diabetic. Anyways, we've got, so we got blood sugar, blood cholesterol, blood pressure, smoking, mom, dad, brother, sister had heart attacks, strokes, bypass stents at a young age. Those are the classic 5. In reality, there's easily 20, 25 testable factors that can harm your arteries. We've talked about some of them, like lipoprotein little a, homocysteine, inflammation like C-reactive protein, including tough ones like air pollution has come on in my field of cardiology. There's an article a week about air pollution and heart disease. And, I'm living in Detroit and we've got this smoky air coming in from Canada. We're having air quality days like we're in Los Angeles lately. Crazy. So, we got air filters in my office and air filters in my home, and you do your best. And, it's passing over, but it's been a real issue this summer and this fall. I think the root cause is we haven't educated people to the point that they're aware that this silent deterioration in your cardiovascular health is a real deal, is a testable deal, is a reversible deal, is a preventable deal. And I tell you, you catch people's attention when you talk about sexual health. They may not care so much that they might have a heart attack, bypass stent. And I talk to all the guys, what are you going to do when you can't get it up anymore and the meds don't work and you're going to start sticking needles in your penis and, putting pumps down there and getting shock wave therapy, which I've done on many men. And it's a role. It's another strange way to approach it, but that's end stage medicine. You got dead meat already. And I'm speaking to the women too. Let's move upstream. And, start taking super good care of yourself when you're 25, 30, 35. That's where the magic happens, Don't assume you're immune. Nobody's immune to the risk of cardiovascular disease. But it's also not inevitable if you like your gym and like your grocer and like the produce department and love your pillows 7, 8 hours a night. That's another one, sleep. The American Heart Association has taught something called, I think, Life's Simple 7 steps to avoid heart disease. Anybody can look that up in a search engine, but they just upgraded it to the essential 8 because they added sleep.
Mm-hmm.
There's so much data that whether we're talking blood sugar, blood pressure, blood cholesterol, actual clogged arteries, sexual health, brain health, memory health. If you think you can shortcut and get by with 4 or 5 hours of sleep, or you have a pathology, sleep apnea, restless legs, maybe you got too many dogs on your bed like I do, something that's interrupting your sleep, you got to really set a goal and try and get that 7, 8 hours sleep most nights of the week. And, catching up on the weekend doesn't really cut the mustard. So you got to restructure your life a little bit.
Yeah, thank you. And we've talked about, so obviously sexual dysfunction is an early clue. We've talked about late clues, which are much more severe, heart attack, death, these sorts of things, and early detection. But besides all of that, are there any other early clues that there's a heart problem, there's a vascular problem that's going on that we haven't talked about that would be good to mention?
Yeah, there's a few that get mentioned in men a little bit more, but it's premature balding, particularly right on top of the head, but there are women that get that. Could mean early nutritional failure, early hormone failure, genetic inputs, early salt and pepper, gray and white. If you're 35 years old and you're prematurely gray, it's been linked to early cardiovascular disease. These are called associations. They're not perfect relations, but they are there to pay attention to them. You don't want to look too distinguished too early in life with gray hair on the sides. In my mid 60s, I kind of like the little gray hair, but it's still appropriate for age. There is a strange one called the diagonal earlobe crease. And there are people, go look at Steven Spielberg, the famous movie producer. Look at his ears. It's on all the search engines. He's got a deep groove in his earlobe. And I tell you, he didn't have it at age 13. It's a strange finding that a doctor described about 50 years ago in a medical article, but it's held up with science that it's about 70% accurate. That's not 100%. But if you look in the mirror and you got a deep groove, and now if you wear heavy earrings, it might get hard to figure it out. But if you got a deep groove in your earlobe, and it's been described in men and women, it's just one more kick in the butt. Nobody's quite sure the connection. There's a theory about your collagen may be weak, and arteries are made of collagen, and earlobes are made of collagen, and the earlobes may be failing to have healthy structure, and your arteries maybe too. Interesting little finding. We talked about, obviously, sexual health. Those are the big ones, actually, physical findings.
Okay, that's really helpful. And I want to make sure we cover a little more on treatment too. Obviously, we've mentioned some of the basics around some of the pharmaceuticals, around sleep. When it comes to food, I typically get a question in my clinic around something along the lines of, if we're talking cardiovascular or sexual health, like what is the perfect diet for,
Right.
for these types of conditions? So can you go into kind of diets? It's obviously hard to go super detailed, but just big picture, do's, do nots, those kind of things when we're talking about both heart health as well as sexual function.
In research studies, and I think like the Harvard School of Public Health has looked at relationships between sexual impairment and diet choices. Actually, fruit shows up as the most helpful. Fruit just rich, I'm talking whole fruit. I'm not talking sugar sweetened or fruit juice necessarily. Not a big fan of drinking fruit juice, but eating berries and eating cantaloupe and eating oranges and eating apples. They're so rich in all the plant-based nutrients we call phytonutrients. That's the scientific data that's there. I'm sure that green leafies and beets help you make more nitric oxide through a dietary pathway that's well known. There is an interesting, since it's always fun to throw out oddities. There's two ways we make this miracle molecule, nitric oxide, which if you want a good, healthy sexual response, you want a lot of nitric oxide, even though you can't directly measure it. So if you avoid smoking, if you have some gym time, if you keep your weight down, check your blood pressure, your arteries are probably going to make more nitric oxide. But if you like fried chicken and Marlboros, you're probably in trouble. So arteries can make nitric oxide. But we learned about 10 years ago that there's a second way that as you chew food, you may make nitric oxide through a saliva mechanism and get a second boost. And that's particularly chewing green leafies like a nice arugula salad, chewing beets, maybe slowly drinking beet juice. That's why there's all those beetroot supplements for athletes and beet lozenges. The marketing industry has picked up on this. You could just eat beets or green leafies. But if you use a antibiotic mouthwash, like I'll just shout out a Listerine or a Scope, studies have shown you lose the benefit. You still get the fiber, you still get the vitamin C, you still get, some of the other wonderful things that come out of the produce department, but you don't get the nitric oxide boost. So shift over, get to some non-antibiotic, unless you're working with a periodontist and you really have no choice for gum health. There is a connection between periodontal disease and sexual dysfunction. And it could be a source of inflammation through the body, could be a source of some bacteria entering and causing what's called endotoxemia and inflammation. So get your gums checked, but also get away from those antibiotic mouthwashes so you can enjoy that nature's bounty, and I choose to eat an all plant diet, and I've done that for decades, but at least get a giant salad a day, eat an apple a day, have fruit, and you're doing yourself a big sexual boost. Beets and greens.
It's super helpful. And I'm really glad you brought up the microbiome. I feel like that's one of the most talked about things right now in the holistic health space, is like the large degree that what's happening orally is impacting so many different things. So we are starting to get a little low on time here. Are there any other treatments though that you want to make sure we cover today to help people in this regard?
Well, there are, I'm a supplement trained doc, and, after exercise, after sleep, after eating, after weight, and all the rest, we can support nitric oxide. There are supplements for men and women that have citrulline in them. Citrulline is a chemical that helps the body make more nitric oxide. It's also in watermelon rind. So if it's summertime or fall and there's watermelon around, scoop some of the white part too. It's rich in citrulline, but there are vitamins that have that. Many people have heard of L-arginine. It's another amino acid that supports nitric oxide, better blood flow, better arteries, more robust sexual health. There are some of the special maca root. A lot of people, MACA, a Peruvian root vegetable that can be designed to boost, actually stabilize female hormones and improve sexual response. There's a version for men. And so we use a fair amount of maca root capsules in my office. I have a kind that one brand's for men and one brand's for women before menopause, after menopause, kind of a neat little scientific approach backed by some published data. That's a good one. I think that's really the key ones, actually.
Okay, beautiful. And just so everybody knows too, the nitric oxide that Dr. Kahn's talking about here, one of the things it's doing is it's a vasodilator. So I just want to make sure everybody understands what's happening, that it's dilating the blood vessels and it's really helping with circulation through that mechanism.
Right.
Is there anything else that you feel like we did not cover today that you're like, this is just an important thing to make sure people hear in our conversation?
No, I think you've asked great questions, and I know it's a lot for people to jot down, but it's really important. I go by a hashtag on social media: test, not guess. Don't assume you're healthy. Well, heart disease is too prevalent. There's too many examples. There's people dropping. There's athletes dropping dead. Get the basics: the extra blood work, the extra imaging of either your carotids, your heart, or both that we talked about. Feed your body premium foods, and I don't know that there's only one diet for mankind, but every diet should have a lot of salads and vegetables and fruits.
Yeah, thank you. And I want to make sure to remind everybody that Dr. Kahn has his Reversing Heart Disease Summit coming out, relaunching again soon. So look for that and look for the information in his speaker bio as far as learning more about his work. And it's drjoelkahn.com is your website. Is that right?
You got it. Thank you.
Yeah. So that'll be in his speaker bio if you just need reference on how it's spelt and all of those sorts of things. And thank you again. This has been so insightful and so useful and so actionable for everybody. So really appreciate you taking the time to come and talk to me today.
A total pleasure. Thank you.
Thank you for tuning in to Dr. Talks. We hope today's episode has enlightened and inspired you on your path to optimal health. Each day is a new opportunity to make choices that empower your well-being. For more insights and strategies, subscribe to our podcast and visit our website, www.drtalks.com. Stay connected, stay healthy, and join us next time on Dr. Talks, real talks from real doctors on the issues that matter to you most.